Hello, I'm Dr. Deborah Burnet. I'm a member of Faith Lutheran Church. I'm a physician and professor of medicine at the University of Chicago, where I lead our general medicine unit, and I'm part of the team coordinating our response for the COVID pandemic. The purpose of this video is to help churches and social networks share accurate and actionable information to protect our health and to save lives. The United States now has the most coronavirus cases worldwide, about 140,000 cases and 2,300 deaths so far. Cases are rising rapidly in the U.S. and in Illinois, and what we do now will determine the rate of rise and the availability of care for people who need it the most. China has had about 82,000 cases. New cases have greatly slowed in recent weeks in China. Italy has nearly 100,000 cases, and cases have also started to slow in Italy. This map from a couple of days ago shows that the U.S. is one of the highest affected countries in the world, and at present is the most affected country. Is all this concern about coronavirus overblown? I think by now we all know it's not. Coronavirus is unlike any infection we've seen in over 100 years. It's much more contagious than flu, it spreads faster, infects more people, and it is much, much more deadly than influenza. This virus is capable of rapidly overwhelming our healthcare system. When that happens, people who need hospital care aren't able to get it. That has happened in some other places already. More people will die, therefore, if we don't all take this seriously and stay at home. What does it mean to shelter in place? All Illinois residents must stay at home, in their house, motel, etc. Go out only for food, gas, or for medical needs which actually require in-person care. Stay home and call your doctor if you're sick. More on this later. Walking outdoors is permitted. Keep a 6-foot distance. The reason for that is others can be infectious and not know it. Essential businesses, of course, are exempt. That's the healthcare workers, the food suppliers, and so forth. The reason for these precautions, again, is that coronavirus is very contagious, much more than flu. The virus is transmitted by droplets when someone sneezes or coughs, and also by contact. It can stay on hard surfaces like a doorknob or an elevator button for many days. Infected people can also carry this virus for many days before they know that they're sick. They look and feel fine, but they can be contagious to others. So when we stay home, it protects all of us. Does this policy of shelter in place really work? Yes, we know it does. In Hong Kong, they instituted a shelter policy very early, and they initially saw a very slow rise in their rate of cases. However, more recently, Hong Kong has reopened their public transit and businesses, and they've seen a much more rapid rise. Singapore has maintained strict distancing and continues to experience a slow rise in their rate of cases. And data from the U.S. confirm these patterns. Kentucky and Tennessee, which are similar demographically, had their first case on the same day in early March. Kentucky instituted very early closure of all their schools and restaurants and had people stay home. Tennessee did not until much later on. And Kentucky has seen a much slower rise in the number of cases, shown in blue on this graph, whereas Tennessee is shown in orange. Illinois cases are rapidly rising now. There's already some evidence that the social distancing we've done over the last couple weeks may have slowed already what would have happened to us otherwise. The cases of coronavirus will continue to rise rapidly in Illinois in the next couple of weeks. Many people will require hospitalization. This is already happening. Just how fast the number of cases rises will determine the actual availability of care in hospitals for sick people. So again, staying at home now will slow this rate of rise and preserve hospital care for those who need it the most. You may have seen this picture. The pink curve shows the rate of rise of cases in a setting where social distancing and stay-at-home is not implemented. The number of cases rapidly rises and outpaces the ability of the healthcare system to care for those people. On the other hand, when people shelter at home, the rate of rise is less fast, the total number of cases is smaller, and it's less likely that the people needing care will outstrip the capacity of the healthcare system. There's an interactive tool that helps you understand this at the link shown on the bottom of this slide, and you can see the effect of varying the degree of staying at home and other measures. So what should we do now? We need to stay at home, whether we are healthy or ill. No visiting. When we visit others, we raise everybody's risk. Go outside only to get food or for exercise, but remember to stay 6 feet away from others. Limit your shopping trips and wash your hands well, especially after shopping and throughout the day. Washing your hands with soap and water for 20 seconds is the most effective way to get rid of the virus, and it's more effective than using hand sanitizer. And remember, don't touch your face. If you become sick, stay at home. Use a mask if you have one, and a separate room if possible to protect the rest of your family. Call your doctor or your health team for advice. There's no need to get a test for this virus at present. Unfortunately, this won't change your care because we don't have specific drugs or treatments for it right now. The reasons you should seek immediate health care or go to the emergency room would be if you have difficulty breathing, increasing shortness of breath, persistent chest pain or pressure, or new confusion or it's unable to arouse the person, or if someone has bluish lips or face. If you don't have a doctor or health insurance, you still can stay home unless you're severely ill. If you need advice, community health centers can help you find access to medical advice using this link here. Many of our local hospitals also have advice lines. Check their websites for this information. The people at highest risk are older adults over 60 and those with serious chronic medical conditions like heart disease, diabetes, lung disease, or immune problems. Our oldest seniors are at the highest risk, so stay in touch with these people. Call them or video chat. Drop off supplies for them, but don't visit. Help them stock up on their medications and their supplies to lessen their need to go out. Remember, when you stay home, you will decrease coronavirus spread. You will help to slow infection rates, which then preserves medical care and resources for those who will need it the most. You will help to save lives, and that's a very powerful thing to do. How long will this pandemic last? In China, their national epidemic began to level off after about 8 weeks. And we're seeing the same in some other places. Our own U.S. guidelines have just been extended to stay at home through the end of April. In Illinois, our cases may begin to level off by somewhere around mid-May. What we can do right now is use your influence to share accurate and useful information and to keep others home, keep people safe, and help preserve their access to health care. Here are some other local resources. The Chicago Department of Public Health and the Illinois Department of Public Health have daily updates on the pandemic and on resources and guidelines. Thank you.